Welcome to Theme 3. In Theme 3, we look at the information and messaging regarding oral PrEP.
Thank you so much. So now that we've given you your first month of oral PrEP, I just want to give you a little bit more information about how to use it and give you a chance to ask any questions if you have any.
Thank you, Doctor. Yes, it all does get a bit overwhelming.
I can imagine. We've already given you a lot of information today, but remember that taking PrEP is a fairly simple process, and we're here to assist you through your whole PrEP journey. So we just want to cover a few basics of PrEP first. PrEP has been shown to be highly effective HIV prevention method. Although it's not 100% effective, it works really well in protecting HIV if taken correctly and daily. And that's why it's important that you continue to use some of the other HIV prevention methods that we spoke about earlier, particularly condoms. And this is especially important during the first 7 days of PrEP use.
So does PrEP protect me from other STIs?
So just to summarize a little, oral PrEP does protect you from HIV if you use it daily and correctly, and PrEP does not protect you against STIs or pregnancy.
Thank you, Doctor. So I now understand that oral PrEP is for use before exposure to HIV and to protect me from getting the HIV, and that it also does not prevent against STIs and pregnancy. Okay, got it.
Okay, great. So now we'll talk a little bit about when and how to take the medication. So oral PrEP is a daily pill. That means that you need to take it once a day in order to best protect you against HIV. It takes about 7 days of daily use in order to build up sufficient concentration of the drug in your body to protect you against HIV. And so it's important to use extra protective methods during that time. You can choose what time of day to take the medication. It doesn't matter what time of day you take it, and it doesn't matter where you eat or not. PrEP can be taken with or without food. It can even be taken with alcohol. PrEP does not interact with common medications such as hormonal contraceptives or STI medications, and so it's safe to use with those medicines. It's safe to use with most medication, but please contact a healthcare provider if you are going to add on a new medication so we can make sure that it's safe to take with PrEP. When you're choosing to stop PrEP, you need to wait 28 days after your last potential exposure in order to effectively protect you against HIV. And remember that PrEP is not intended to be a lifelong medication. It's only intended to be used during those periods of your life where you feel that you are at increased risk.
Okay, so let me just make sure I've understood everything you've said. So I need to take PrEP daily at any time of the day, with or without food, and even when I have to take hormonal contraceptives or alcohol. And remember that in the first 7 days, I also need to use other protective measures so that I'm protected from getting the HIV, and also to give the drug enough chance to build up sufficient concentration. And it is not a lifelong medication. I only need to use it during this time of risk.
Yeah, that's perfect.
So, Doctor, what happens if I forget to take the pill? You know, some days are just unpredictable.
Yes, of course. So if you forget to take the pill, just take it as soon as you remember, and then you can continue with your schedule as normal. If you skip a day, that's fine. Just continue with your schedule thereafter, and remember to use extra protection if you feel that you are at risk.
Okay. And what happens if I vomit the pill?
If you vomit up the pill, if you vomit shortly after taking the pill and you can actually physically see the pill in your vomit, then you can retake the pill about an hour later. But if you vomit later and you can't see the pill, then don't worry, then just continue with your normal schedule afterwards.
Okay, so I'll try not to vomit. And are there any other side effects, you know, such as maybe weight gain or weight loss?
Well, the PrEP medication shouldn't have any effect on your weight, and you shouldn't see any weight gain or weight loss. So if you are experiencing symptoms like that, please come into the clinic so we can work up for another cause. PrEP, however, does have some side effects, but they're relatively uncommon. About 1 in 10 patients experience the side effects, and these side effects are usually mild and self-limiting. Common side effects include mostly tummy stuff like nausea, vomiting, constipation, tummy cramps, and some people also experience headaches. But these are self-limiting, which means that within a month they should disappear, and they're also really easy to treat. So if you are having any side effects, please come into the clinic so we can give you some medication to resolve the side effects. Also note that these side effects are not doing any long-term damage, and PrEP is a really safe medication to take.
So it seems to be really easy, but what happens should I decide that I want to stop taking the PrEP or I do contract HIV at some stage?
So those are two really good questions. So your first question about choosing to stop PrEP, you're welcome to stop PrEP at any time that you want to. Cycling on and off PrEP is really easy, and we just want to give you a bit more information about that. So you can choose to stop PrEP whenever you want to, but please come to speak to us before you do so that we can discuss what has changed and why you're wanting to stop PrEP, and so that we can provide you with other prevention methods as well as risk reduction counselling. Remember that when you stop PrEP, you'll need to take it for 28 days after your last exposure to make sure that you're adequately protected against HIV. If you choose to restart or cycle on PrEP at a later stage, just remember that you'll need to do an HIV test as well as other investigations to make sure that it's safe for you to restart, and that there'll be that 7-day build-up again to protective concentrations to protect you against HIV. If you come back for any of your follow-up visits and you test positive for HIV, that's okay. We're here to support you through that process. We'll have to stop your PrEP, but we will immediately start you on antiretroviral therapy, which is lifelong ARVs that will provide you in order to keep you well and healthy.
Thank you so much, Doctor.
It's an absolute pleasure. That's what we're here for. And just remember that you're welcome to come back at any time should you have any further questions about PrEP.
Now that we have come to the end of Theme 3, let's summarize what we have covered in the video. PrEP should be taken daily. It takes 7 days of continuous use to build up an effective concentration and should be taken for 28 days after the last exposure. PrEP is not intended to be a lifelong medication, but should rather be used during seasons of risk. PrEP does not interact with contraception, STI medication, or alcohol. Side effects are uncommon, mild and self-limiting. Only 1 in 10 will experience them. It is important to both counsel patients and provide symptomatic support. Patients should be encouraged to still use condoms, as PrEP is not 100% effective and does not protect against pregnancy or STIs. We have come to the end of this video for Theme 3. In the next theme, we will continue with the maintenance process and discuss what to do in follow-up visits. Remember, you can come back to this video at any time and watch it as many times as you need to. How are you doing with those checkpoint questions? Are you getting the hang of them?